Hey, this is your boy, Dr. Collins, on one of my favorite subjects today. This is Dr. Collins from my segment, Ask Dr. Two. Listen, I'm sitting in my practice, man, and one of my favorite subjects, because I've had a little apnea, is sleep. What's so crazy is how do we die in our sleep when your body's at rest? And some of us, unfortunately, it's because some of us have obstruction of air, which is called sleep apnea, that's coming into our lungs, all right? So that means some of you who actually snore, right? Pretty loud, not all, but some, who snore or you sleep with your mouth open. Out here in my office, we have a CBCT scan. That's an X-ray where we can actually see your throat, right? And we can see if that throat has been compromised. Sometimes your tongue, as we age and we get a little weight, our necks get bigger. You don't have to be fat. You might be just a, person like myself in the gym. Just playing. I don't go to the gym. But, well, I do go to the gym sometimes. But anyway, if you could be a guy, man, who just a big, big old muscular bound kind of dude, you just got a big old neck, right? Or you can just have, you gain some weight and your tongue actually get fat. People don't know that. People didn't know that your tongue still grows and sometimes it gets fat, right? So what happens when you sleep and your head's back and your tongue is going back to your throat and you don't have any airway? You're not getting oxygen, all right? So this cool little sign right here, man, tells you something, some of the histories of some things, what happens when you have apnea. Some people who history of stroke, some you snore, actually acid reflux, man, weight gain. You know how you can't get that? You trying to get on that gym, man. You got 5 pounds and this is over. You can't get past that 5 pounds, right? Sometimes that happens to do with you also sleep, man. There are 4 stages of sleep. You have stage 1, 2, 3, and 4. That fourth stage is your rapid eye movement, when your eyes just do this all night, right? But what happens is most times we don't get to that 4th stage, right? That first stage is when, how you sleep for a second and you wake up real quick. Somebody said, man, you've been asleep for 30 minutes. Man, I ain't been asleep. Yeah, you were actually asleep for 30 minutes, but it seems like you were not asleep, right? So sometimes what happens is you don't get to that 3rd stage. Also, 3rd stage is when your body is basically doing what? Developing itself, right? So that's when you're healing yourself. So if you don't get to that particular stage, then you go back to that 1 stage. So it's like someone just throughout the night, every hour, they're just pushing you 14 to 15 times, right? So you're not getting that full rest that your body needs. So you have apnea. So what that means is, and more importantly, you're not getting oxygen into your system. I can put right now, you can come to my practice and I can put one of those oximeters on your fingertip, right? And it probably read about 98, 97, all right? And I can guarantee you, I can tell you to hold your breath and hold your nose. You do know we breathe through our nose. I just didn't know if you knew that or not. Some of you breathe through your mouth, that's not good. You breathe through your nasal, okay? But I can tell you to stop, don't hold your nose, stop breathing, right? And I can guarantee you, you probably don't get to 95 or 96 or 95, and your brain tell you, hey fool, you better kill yourself before you release your nose and start to breathe, right? But when you're asleep, there's sometimes patients are getting to 95, 90, 80, 70, 60, right? They're not breathing at all. So what happens if you're not breathing, I'm still ain't breathing. And all of a sudden you gasp for air. You bite down. You only bite down about 10 to 15% of the day. All right? When is that? You answer that question first. Let me see. I don't hear you. 10 to 15% of the day is when you bite down. When you do what? You chew, right? And when you do what? Sleep. If you close your lips right now, close your lips, try it out. Your teeth are what? Open, right? So you only bite down when you're chewing and you're sleeping. All right, so that's important to know. Listen, man, go get checked. If you're snoring, if you're real tired, You know how you're driving, man, and you sit at that light and your eyes kind of closed? How do I know? 'Cause my crazy self do it all the time. And your eyes be closed but up. And when the light turns green, for some kind of way, you open back up and you keep going. I know one or two of you like me. If you have that issue, or you feel like you're tired throughout the day, or you're waking up men or women and going to the restroom at 4 or 5 in the morning consistently, right? Your body is not supposed to do that. Libido, men, if you just can't get right, you know it, your woman know it, just can't get right, man. You might have that apnea, you might want to check it out. If you have some of these symptoms, I urge you to go to your local physician or find a dentist who actually does sleep. Now you ask, how do we get involved as dentists? Well, there are 3 stages of sleep apnea. One is mild, moderate, and severe, right? The gold standard of all time is your CPAP. Why? Because that's straight oxygen going into your body, okay? Problem with CPAP, it's loud, right? And most people don't like to wear it. And then if you move around like I do in the bed, it might keep popping off, okay? The other way you can do a correct is doing an oral device. That's where dentistry is involved, all right? So if you're mild to moderate, then you can also do an oral device through dentistry. Now, we as dentists, we do not diagnose sleep apnea. Here in my office, we have a sister program that they will do a in-home study for you, right? They will send you a device. You would actually wear that device that night. You would send it back to them, not to me. Send it back to them. They'll bill it medically, and they will actually see if you are stage 1, stage 2, or stage 3 in apnea. And if you're stage 1 and 2, they will tell you you can either do the CPAP or you can do the actual oral device. So listen, hey man, stay tuned. I appreciate you looking at to me, man. Listen, this is a very serious, it's to my heart. It's a very serious problem that a lot of us have, man, and it's really killing us, man. I've had 2 friends in the past few years that have passed for no reason at all at 42, 43 years old, man. So listen, go get yourself checked out. We appreciate you. Thanks for checking me out. Ask Dr. Collins. Find me. Appreciate you.